our R2 project. Now, everybody knows that ACP is an important issue, but having spoken with many of you, several things have come up which I think are several myths associated with ACP conversations. The first being ACP conversations are long, they're tedious, and they're complicated. Number two is that ACP conversations should only be had with old and complex and very sick people. And number three is that they are actually quite uncomfortable to have, especially on your first patient encounter or your first time meeting that patient. But from the research that Sam and Terry and I have done, and with the help of the CFPC, we've actually found that ACP conversations can be short, they can be actually comfortable, even if it's the first patient encounter, and also they can be quite straightforward. So why don't we, instead of telling you guys about some of these things, why don't we act it out? So can we get a volunteer to come up? Anybody? Oh, Michael, okay, perfect. All right, great. Come around. Woo. Okay, so just to set the scene, Michael is a young and healthy individual who you wouldn't think to do ACP conversations on, right? But he's on top of his health. He wants to keep himself in good health as possible. So we're just in the middle of our periodic health exam. I'm a doctor. This is my patient. So we're just talking. The topic of ACP comes up. And so Michael, so this is just a question we have with everybody. You're young and healthy now, and good for you for staying on top of your health. But just in terms of should this thing happen where you get very, very sick, you can't make medical choices for yourself, have you thought about who you might trust to make medical choices for you?
Yeah, I would trust my R2 project partner, Josh.
All right, so great. All right, so I will document that your R2 partner, Josh, is somebody who you trust. Okay? All right, perfect. So moving on to other issues now. Okay, thank you very much. That was it. Thank you very much, Michael. So that's it. That's essentially it. That is all there is to an ACP conversation with somebody who is young and healthy and completely asymptomatic. According to the triage system that the CFPC has developed, it's totally appropriate to have an ACP conversation exactly like that. And as long as we document it, it's there, the patient is thinking about it, we're done. So now, I know what you guys are all thinking. You guys are all thinking, what about that patient that's sick, that's complicated, with a huge long list of questions? What do we do? Right? So we've acted that out for you too. So Terry is going to be your patient, and Terry's going to play the role of an elderly individual who just has so many chronic diseases that's off the charts, and you countless medications, the whole shebang. And guess what? I see she has a list. Uh-oh. Okay. All right. So let's get started. So we're in the middle of our periodic health exam. The subject of ACP comes up, and so Terry, we should talk about something called advanced care planning now. And so, as you know, you have a bunch of chronic diseases, and if one or all of them get worse over time, you might be in a condition where you might not be able to make medical decisions for yourself. Have you thought about who you might trust to make medical choices for you, and what those choices would be?
Yeah, after my second hospital admission, the nurse brought up the idea of advanced care planning, but I don't really know what these worst case scenarios are or how I should choose the person to make the decisions for me.
Okay, well, good. It sounds like you've already heard this concept before, right? And this ACP concept, as we doctors call it, it's all about trying to help you make the best choices that you would want, as opposed to what we want for you, right? So that's what these decisions are. And as opposed to, in terms of the person you would choose, it's just someone you trust. I said a patient earlier today who trusts a lot in his research partner. So if that's the person that you trust, then definitely go with that. Other people find family members, spouses to be very good people as well. People who understand you, people who value you. And the last thing is that these decisions will change over time, and they will change and evolve as your disease progression evolves. So we'll have further conversations as your disease evolves, and we'll talk about medical choices then as well.
Okay, so if I make a decision now, I can change my mind later?
Yeah. One of the good parts about advanced care planning is that you don't have to make a decision now. And even if you do, you can always change your mind later.
Okay. It still sounds a little vague to me, though. Is there any paperwork involved, anything legal, forms I have to fill out?
Actually, that's a good point you bring up, because there are some forms, but the Alberta Healthcare System has them all nicely contained in this green sleeve, literally a green sleeve, as you can see. And so there's a bunch of forms in there. I'll give this to you. Actually, we have a very good social worker here in this clinic And social workers do this much better than doctors do, but they're going to be able to fully explain everything that's listed in this document, talk about all the questions that you might have, and give you some ideas about making choices that you might not have even thought about. Okay, would you like me to set up an appointment with her for you?
Yes, I'd appreciate that.
Great. Okay, so I'll just do that right now after the visit, and you can expect a call from her in about a week or so.
Okay.
And when you have the conversation with her, come back, book in for an appointment, and we'll talk about what you guys have talked about. All right?
Okay.
Okay, great.
Thank
All right,
you.
so moving on to other issues. Okay, so that was an ACP conversation for a patient who is sick, complicated, has a series of questions. And you can tell that we haven't gone through her whole list yet, but we've taken advantage of the fact that we have allied healthcare professionals who are able to do this stuff better than we can. And it's an easy consult. It's on MedAccess, so feel free to do that. Now, Sam, how long did that conversation take?
2 minutes.
And how long did that first conversation take?
About 32 seconds.
Right. So you can see this myth of ACP conversations being too long, too complicated, busted. Right? And even for people who say, like, oh, it's awkward to have ACP conversations with the first patients when I've never met them before. Well, it's actually, you can actually make it in a way that you can actually speak in a way that, as you just seen, is actually quite nice and comfortable. Did I make you comfortable, Terry? Okay, good. Thank you. Okay, all right. So now with that, that's it. That's all we have. Hopefully you can take something away from this. We just ask that you document all your ACP encounters on your MedAccess. So it's under Profile. And what you do is you go into Profile, and then you find Preferences, and then under Preferences you'll find ACP. And then just make a note that you've had at least the first conversation with the patient. And you'll note to do these ACP conversations because you'll see a radio button on all your periodic health exam templates to remind you to do those. So thank you very much, everybody, and please make use of this resource. You'll be getting an actual card. This is actually still a draft version, but you'll be getting an actual card sometime later this year. All right? Thank you so much.